Personality is what makes us unique. It shapes how we think, feel, and behave. Sometimes these patterns of thinking, feeling, and behaving can be inflexible and unhealthy. When these patterns cause significant distress or problems in a person's life, it might be a personality disorder. These disorders can make it difficult for individuals to maintain relationships, hold jobs, and live fulfilling lives. Traditional approaches to personality disorders often focus on the differences between them. While this is important, focusing solely on the distinctions can overshadow the common ground these disorders share. The common factor approach takes a different perspective. It shifts the focus from what makes each disorder unique to the underlying factors they share. Instead of just looking at the symptoms that differentiate one disorder from another, this approach looks for the common threads that weave them together. These common factors can include things like difficulty regulating emotions, forming secure attachments, or maintaining a stable sense of self. By understanding these shared factors, we can develop more effective ways to diagnose and treat personality disorders. Imagine a group of people, each holding a piece of a puzzle. Each piece represents a specific symptom or characteristic of a personality disorder. The common factor approach is like stepping back to see the bigger picture the puzzle creates. By recognizing the common factors, we gain a deeper understanding of the underlying mechanisms driving these disorders. This allows us to move beyond simply labeling someone with a disorder and begin to address the root causes of their struggles. Traditionally, diagnosing personality disorders involves identifying a cluster of specific symptoms outlined in diagnostic manuals. While this method is essential, it can sometimes be like trying to fit square pegs into round holes. The common factor approach offers a more nuanced perspective. By considering the shared underlying factors, clinicians can make more accurate diagnoses, even in cases where symptoms might not perfectly align with traditional categories. This can be particularly helpful for individuals who don't fit neatly into one specific category. Section 5. Tailoring treatment. The power of common factors in therapy. One of the most significant benefits of the common factor approach is its impact on treatment. By understanding the common factors driving these disorders, therapists can develop more targeted and effective interventions. For example, if a therapist recognizes that difficulty regulating emotions is a common factor for a client, they can incorporate techniques like mindfulness or distress tolerance skills into their treatment plan. This personalized approach can lead to better outcomes for individuals struggling with personality disorders. Section 6. A common language, bridging the gap between therapists and patients. The common factor approach also provides a common language for therapists and patients to use when discussing mental health. This shared understanding can help to reduce stigma and foster a stronger therapeutic alliance. When therapists and patients are on the same page, it can lead to increased trust, better communication, and ultimately, a more successful therapeutic journey. Section 7. Case Study. Sarah's journey from isolation to connection. Sarah, a young woman in her early 20s, had always struggled with feelings of emptiness, instability in her relationships, and intense fear of abandonment. She had been diagnosed with borderline personality disorder, and while the diagnosis provided some explanation for her struggles, it didn't seem to offer a clear path forward. However, when Sarah began working with a therapist who utilized the common factor approach, things started to shift. The therapist helped Sarah to identify some of the common factors contributing to her difficulties, such as a fear of rejection and difficulty managing her emotions. By addressing these underlying factors through therapy, Sarah began to develop healthier coping mechanisms and build more stable relationships. Section 8. The benefits of a shared vision. Advantages of the common factor approach. The common factor approach offers numerous advantages in the study and treatment of personality disorders. It provides a more holistic understanding of these complex conditions, moving beyond surface-level symptoms to address the root causes. This approach also fosters a more collaborative and empathetic therapeutic relationship, empowering both therapists and patients to work together towards recovery. This can lead to more accurate diagnoses, more effective treatments, and ultimately, improved quality of life for individuals living with personality disorders. Section 9. A unified future. Embracing common factors in mental health. As our understanding of mental health continues to evolve, the common factor approach stands as a beacon of hope and progress. By embracing the commonalities that connect us, we can break down the barriers of stigma and create a more compassionate and effective mental health system. The common factor approach is not merely a shift in perspective. It is a call to action, urging us to move beyond traditional diagnostic labels and embrace a more holistic and humane approach to understanding and treating personality disorders.